Hi guys, this is Vicky. I want to take a few minutes to help you understand prioritization just a little bit better. As you first begin your nursing career, prioritization is very important to have a good grasp on, as you need to really be listening now in your fourth semester and be prioritizing from the information that you get from the nurse which patient needs to be seen first, second, and third. First, I'd like to take a minute just to define what is prioritization. And it's really deciding which needs, interventions, nursing assessments, or problems really require immediate actions, and which one of those really could be delayed until a further time because they are not as urgent. It's not only important to know what to do first, but it's also imperative to understand the result of delaying an action. Because as we know, if postponing an activity, an assessment, a nursing intervention, it does pose the risk that an unfavorable outcome can occur. If this does occur, the nurse needs to understand that the level of priority for this nursing intervention, action, or assessment does become high priority. Next, we'll take a look at the hierarchy of RN needs. We know that to provide effective care to a patient or group of patients, the nurse really needs to consider this specific pyramid. Some of the primary goals, the first obviously that we teach so much in nursing school is about caregiver safety. Safety is really one of those primary goals, and safety for the patient and also is not only for the patient but also for the health care provider. We know that it's essential that we care for ourselves, or we're really not able to effectively care for the patients. So remember that once you graduate from here, that use your gloves, use isolation precautions. Take the correct means to make sure that you remain safe in providing care. The second level on this pyramid is the caregiver accuracy and safety. And we know that to be able to provide safe and accurate care, we need to make sure that the things that we're doing, the things that we've learned, are the things that you're implementing in care, in practice. So such things as doing your 5 rights of your medication safety. Maybe it's watching a really confused patient closely, sitting outside the patient's room, staying close to the patients, making sure that safety is your number one priority, because if we remember back from Maslow's, we have to ensure that these basic needs are being met before we can go even further up on the pyramid. Our secondary goals really focus on the caregiving environment and the work process. So we know that the visibility of the patient is essential. Direct visual access to patients, so one can track their status. We know that the greater visibility that we have to the patient, it not only improves the work process, but also the quality of care that we provide. It also improves the exchange of information and promotes better and a more regular communication among staff. If you're sitting at the nurse's station, do you really have direct visual? Can you see that patient? Can you tell if their status is declining? So it's really ensuring that you put yourself in the best environment to be able to not only get your work done, but to also ensure that the patient remains safe and that you are that patient's advocate. The next rung is communication. So we talk a great deal in this nursing program about providing both written and spoken communication to team members and how crucial and essential it is. So between being visible and communication, it really keeps the nurses connected to each other and to their patients, which we know is essential for assessment, information, and also for providing direction with delegation or speaking to a provider. Next on the rung is that efficiency. So we know that in order to provide good care and to be able to effectively meet our patients' needs and also our needs. We have to make sure that we're always looking for ways to save time in our jobs. And efficiency is essential to caregiving since workload and stress levels can be high, especially on different particular units. So efficient work environments must not only enrich the caregiving experience, both for the RN but also for the patient. And so all of these are going to help improve the ability to prioritize your care, manage your time, and make sure that you're providing that safe and effective care for the patient. We know, as you've probably noted in clinical, when you forget things, it really does delay the amount of time that you're able to spend with the patient, get charting done. So it's always thinking ahead, critical thinking. What am I going to need before I go in this patient's room? How can I prioritize the actions that I currently do to be able to meet the patient's needs, but also make my workflow more efficient? Next on the list is privacy, and we know that we must maintain confidentiality of our patients' personal information, both written and spoken at all times. And we do have the opportunity to find areas, or we should at least find areas for private and quiet conversations with both peers and families. I can't tell you how many times I've seen nurses giving report on other patients when doors are open, other patients can hear. So I challenge you to please make sure that you find private and quiet consultation areas to give report or to speak with families or to speak with providers. It is really essential. And then last are those preferred goals. And these are really, we know that safe and accurate caregiving is the primary goal, but providing care in places that allow for visibility, communication, efficiency, and privacy enhances the quality of care. So once these goals are met, then the RN can tend to higher goals, which enhance the RN work experience. So we know that the ease of use and caregiver comfort are really our highest areas on this pyramid. And we know that we prefer products that are familiar with us, and we want to make sure that the patient's physical, mental, and emotional comfort are met to improve outcomes and work satisfaction. So these are really the highest points on this list. So we have to make sure that we are meeting those lower topics on this grid to ensure that we're providing safe, effective care that's prioritized in a way that meets our patients' needs. So now when we take a look at the ABCs categories for patient care, I want to spend a few minutes just talking about this. So when you're getting report, you really need to hone in on what the nurse is telling you. Listen for those details, ask questions, clarify, because what you should be doing is starting to classify these patients into, is this an A patient, B patient, C patient, or D, or what I need to do with those patients, the nursing interventions, maybe the communication. What is an A, B, C, or D? And what do I need to do first to ensure that the patient is being safely cared for? So when we think of A action items, these are really interventions that require immediate attention. They're emergent. They're usually problems related to airway, breathing, or circulation, just like our ABCs that we've always been learned, or you've learned. Our B items are interventions which are required to be completed in a timely fashion. So these items can be delayed, but they should be completed in a timely fashion. And typically after you've identified those A items and they're completed, then the nurse then moves on to her B category, because we know that these need to get taken care of. Some things within this category could potentially be scheduled medications, maybe some upcoming tests that aren't emergent, but that the patient really needs to get to, like a chest x-ray if they're not in respiratory, distress. Teaching, any type of teaching is definitely item B. And maybe wound care would be in this category. There are many different action items that you could put in a B category. Action C are really interventions that usually can wait. Maybe that is that wound care that's not essential that you need to do right now, but maybe you could do that in 4 or 5 hours. It's not going to affect the patient's care, but they should still be done. And then category D are interventions that may not be necessary. These are things that are nice to do, but not always required. And, sometimes they just don't get done. And I think of things, maybe you're on a committee in the hospital and you've thought, oh, okay, today I'm going to take care of my patients, and then maybe for the last half an hour, I'm going to take a look at this new policy and I'm going to give feedback on it. Those things may not actually get done. So it's just important to really think about our A, B, C, and D items. It's not uncommon for somebody to want to do D items first because maybe they're easier or they're, more fun. But if you put more of your attention on your A items, which you should because those are emergent issues, your ability to take care of your patients is going to be much improved, and you're going to be the advocate for that patient. Okay, so this is just another breakdown. So patient assessment, who first, right? So again, we have our A category. So who, and remember, this is just the same as Maslow's hierarchy. We want to make sure that our A pile is down lower. So these may be our emergent needs, our airway, breathing, circulation problems. Maybe we have significant vital sign changes. Patients either in a hypertensive crisis, or their blood pressure is very hypotensive. Maybe the patient is having a change in LOC. Are they having a stroke? Are they sedated from surgery? Are there any critical labs for the patient? Does the patient have ABGs that we should be assessing? Does the patient have an elevated troponin or CKMB? Or do they have an elevated D-dimer that's really going to put this patient at risk? Okay? Especially any patient who's post-op should always be in a type A category. These patients are at high risk, risk for sedation, that impaired gas exchange, maybe risk of bleeding due to the incision. There are also some diagnosis patients who really are a type A category. Maybe it's those acute airway distresses such as asthma exacerbation and they're just newly admitted. Asthma exacerbation, pneumonia, maybe acute congestive heart failure, that they have a high risk for acute airway distress. Maybe it's a STEMI. Maybe the patient is coming in with chest pain and you're working in the emergency room. Or the patient is at a high risk for sepsis. These are patients who are type A. You need to get in there. You need to do an assessment on them. You need to make sure that you're warding off any type of danger. Next is our category B again. So remember, these are patients who are in need, but they're not going to die if you don't handle their issue right away. So some of the things that I've lumped into this category is pain. Now, although pain is a large factor for people, it's typically not going to harm them. So it is a priority, but it's not a category A. But what you have to keep in mind when you think about pain is, why is the patient having pain? Maybe they're having pain in their arm. Is that a sign of an MI? So pain could potentially become a category A. So you have to be critical thinking. You have to know or be thinking, what could this pain become? And could it be a class A category that I really need to be worried about? Another area is that elimination. So is the patient constipated? And although that's not a class A, it could become a class A category if we haven't dealt with it over a long time. Could the patient have a small bowel obstruction or an ileus? So this is another example of a class B. Skin integrity, maybe we want to make sure that we're assessing them so that they don't get, we don't have the patient getting ulcers. Or nutrition, we want to make sure that we're assessing because we could really lead to the inability to heal correctly. Then we move up to C. So C is patient education. And at least in my mind, it's definitely a priority that must be completed, but only after our category A and B problems are really dealt with. Another area that I think of in category C is really those psychosocial issues. They definitely need to be handled before the patient is discharged, but it's not an immediate emergency unless obviously it deals with the safety of the staff or safety of the patient. And then category D, I didn't actually put a little thing up here on the triangle, but it's really any ADL that could potentially be delegated to maybe an LPN, CNA, or MA. Maybe it's helping the patient wash their hair today. So when you're doing your assessments and you're assessing on how you're going to prioritize these patients, think of it much like a triangle. And you need to ensure that the bottom of your triangle is assessed first before we move up to the peak. To take a few minutes and really think about, how do you prioritize your clinical day right now? How are you assessing your patient's needs? How are you evaluating and weighing out each task or process to ensure that your patient's needs are being met? So take a few minutes, maybe pause this presentation and write down what some of the things are that you're currently doing. When I go and evaluate or weigh out each task or process, there are some criteria that you could take a look at. One, is it life-threatening or potentially life-threatening if the task is not done? Would another patient be endangered if this task is done now or left for later? Is this task, intervention, assessment, or process essential to patient or staff safety? Is this task or process essential to the medical or nursing plan of care? Okay. But in every case, you must understand the overall patient goals. The context and the setting of these goals is also essential. Some activities must be done at certain times, and their timing may be out of the nurse's control. So you really need to take a look at your overall day and try to prioritize when you're going to be doing things. One thing that I've found helps me is really creating a personalized worksheet, which I'm hoping that you've started to work on throughout your nursing courses here. But those worksheets really do help you stay organized. They do help you stay up to date on what your patient is going through, or maybe what lab values. So they can help drive your care for that patient that day. Anyways, so I'm hoping that this little bitty lecture has helped you. Typically in online nursing, we don't do a great deal of lectures, but I do feel like prioritization is essential and is key, that you really have a very good understanding in order to keep your future patients safe and also to keep you sane. Because if you can handle if you can get this under control, your day and your ability to be a very effective nurse is going to be greatly improved. So if you have any questions about this, please let me know and we can talk about it and hopefully answer your questions.